I really like microneedling, even though I'm a laser surgeon. And the reason for that is because I think microneedling is superior at treating lines around the mouth, what we used to call smoker's lines, although I know plenty of people who never smoked who have those lines around the mouth. It's also particularly good for large pores, particularly on the nose and sometimes on the cheek area. And last but not least, for various scars or even stretch marks, whether they're on the face or the body, I have found that microneedling is superior to even laser treatment for those things. Microneedling devices come in a couple of different varieties. The medical microneedling devices are much more than the roller needles that many times estheticians use. The medical devices have individual tips with various numbers of little pins or needles in them. The one that I use has 36 tiny little needles that puncture the skin at regular intervals. By so doing, you're producing a wound, a controlled wound in the skin that actually causes new collagen, which are the building blocks of our skin, to form. And so it's particularly helpful for remodeling the skin. When we do microneedling in the office, we typically will use a topical numbing cream that we apply to the skin anywhere between 15 and 30 minutes prior to the treatment. This adequately anesthetizes the area so that people don't even feel the needles, even in delicate areas like the upper lip. Most people say at most they feel a little bit of pinching in the more sensitive areas, and that would be maybe right here, but the other areas they barely feel at all. After the treatment, the areas look a little bit red. We actually will stop any bleeding that does occur during the treatment with cold water-soaked gauze so that you don't leave the office with any bleeding. You only have a little bit of redness, and the redness can be there for as little as a day or two and as long as a week. For the most part, patients come in, say, on a Friday when they don't have much going on over the weekend, and they're ready to go back to their work and regular activities by Monday. They can even put on makeup as early as the next day if you take other certain precautions, like the certain creams that we recommend. I commonly recommend microneedling in my office for lines around the mouth. When we do that, we'll do the microneedling along with Clear and Brilliant, which is our baby Fraxel, to even out the skin tone on the rest of the skin on the face so that everything blends seamlessly. So in the same treatment session, I will do the microneedling on the upper lip or even around the mouth, and then on the entire face, I will do the Clear and Brilliant treatment. Microneedling is one of the least expensive treatments that we perform in the office. The prices range from $250 and go upwards from there. Very quick and easy and very popular.